Hello, and welcome to Ask the Doc. If you're new to this channel, this is a monthly show where viewers have the opportunity to ask questions of experts in Alzheimer's and dementia research. My name is Christian Salazar. I'm a neuroepidemiologist and also a co-host for this show. Today, I'm thrilled to introduce to the program Dr. Steve Tam. He's an esteemed neurologist and geriatric medicine specialist from the University of California, Irvine. Dr. Tam graduated from UC San Diego School of Medicine in 2004 and completed his residency and internship at Scripps Green Hospital, followed by fellowships in geriatric neurology and geriatrics at UC San Diego. Alongside his clinical contributions, he serves as an associate clinical professor at UCI's School of Medicine and is board certified in both geriatric medicine and internal medicine. Dr. Tam is also a clinical trials researcher, serving as the site principal investigator for the EXERT and the NEAT trials, which we'll have a chance to ask him about shortly. Welcome, Dr. Tam.
Thanks, Dr. Salazar. Thank you for having me here.
And thank you for joining us. And welcome to our viewers. If you are attending on live on Facebook or on YouTube, you can participate in the question and answer with Dr. Tam by typing in questions into the comment box that is accompanying this video. And we always prioritize your questions. Okay, Dr. Tam. You've been involved in the EXERT trial, which is a lifestyle intervention. So before we go and begin with discussing the results of this trial, can you briefly just give us an overview of the objectives of the EXERT study for listeners who are not aware of this study?
Yeah, no, thank you for the introduction. Thanks for having me. First off, I would just want to say, thank you for the opportunity to be here. We do a lot of research work, and for all of our participants, I want to make sure that we are thanking them on a regular basis. We're very grateful for their participation in all this work. Without them, we couldn't do this. And so one of the trials that I had the fortune to participate on is the EXERT trial. And the goals and objectives of that trial really were to look at folks that had memory concerns, memory symptoms, early on symptoms, primarily in the form of mild cognitive impairment, and look at what the impact of a behavioral intervention in the form of an exercise program, two different kinds of exercise programs, might have on memory and cognition. And that's the general gist of it in terms of objectives.
I see. And thinking specifically about physical activity and aerobic training, how might this impact the progression of memory loss? How might this mechanism work?
Yes, the hypothesis has been that based on some prior studies, other studies looking at impact on different hormones and all the different things that happen in the body with exercise, that exercise might be able to improve certain aspects of brain function, nerve function, so much as to preserve as much as you can in terms of cognitive and memory function and keep things working. And that's the basis of kind of like where we got to with this study.
Mm-hmm. And was there a non-intervention arm that was used in this study?
So the way this study was broken down, and we're probably getting into the details of it, was that there's essentially two arms of it. One looking at an intervention where folks were doing a more intensive exercise program regimen, and those that were doing a less intensive in the sense that it was more stretching, strengthening, without all the aerobic components to it.
I see. And can you shed some light on what the significance is of partnering with YMCAs, local YMCAs, to actually conduct this study, because I've heard that participants have to really just go in there and have undergo these strenuous aerobic exercises in some setting, and YMCAs were chosen. Can you talk a little bit about the significance of that, and also with personal trainers that had to be involved in the study as well?
Yeah, I think that the main, big issues with challenges with these kind of studies, and I think this is unique from this sense, is that, it is a behavioral modification. It's an exercise study to many ways in terms of how you think about it or you want to think about it. So it's not like just taking a pill, right? So I think that that's a very unique aspect of it, that you're trying to implement a behavioral intervention, essentially. And we clinically, we tell folks that you got to exercise more. You need more exercise because of your blood pressure, or for diabetes, or for your heart, and whatnot. And sometimes it's just, we tell them that clinically, but we always know that the challenge is that, okay, we might do that exercise program maybe for a few days, a few weeks. It's hard to keep up with. Those are the challenges with that, right? That's unique, I think, in terms of the study. What is involved and what's being asked of our participants, right? And we're asking them to do it over a long period of time, not just that 1 week or 2 weeks on there, right? So having a partner, is definitely well needed. Certainly, I'm not a physical trainer myself, right? But having that ability to have people kind of direct them with that, whether it's aerobic exercise or stretching and balance and range of motion activities, you kind of need that direction, I think, in that sense, and having that access to that direction, rather than putting somebody out there on their own. And that's one of the challenges with this, I think, in terms of actually being able to gather, complete enough set of information to be able to look at, and knowing, and then being able to know how reliable that information is, in terms of whether or not they actually went and did the exercise, the behavioral intervention.
Yeah, and along those lines, of getting people to exercise and engage in this intervention, you recently co-authored a paper on the recruitment for this study. And can you just highlight some of those challenges, recruitment challenges that were faced initially, and how you addressed them?
Yeah, and again, I think it speaks to the study, like where we're targeting in terms of who we're looking at, the folks that we're looking at, as well as the intervention that's trying to be implemented here, right? So, the target group for this was really mild cognitive impairment as a diagnosis for patients, for participants and folks. And, we know that can tend to be an underdiagnosed diagnosis out there, right? In terms of what people go into clinical offices with, and what's discussed, and whether or not they come out with that diagnosis. So there in itself is a challenge, I think. And so, that we saw that during the course of the study, and, finding enough individuals that have that diagnosis, is a challenge on there. And so, if we do studies where we only reached out in the medical community at the doctor's office, the medical offices, sometimes you're not going to cast a broad enough net in that sense. And typically, when you look at research studies, you see the advertisements that are out there. A lot of times what happens is that it's kind of centered within that, medical community, or there's that medical perspective, right? And so, you think about medications, or you think about different drug medications or drugs to try for like a certain disease or whatnot. So again, this is kind of unique in the sense that, hey, we're trying to put in a behavioral intervention as what the target of what we're looking at. So you kind of have to explain that a whole lot more. You got to give that more information about what that involves. It's very different and unique in that sense. And you might just not be able to reach enough folks when it's only going to the hospital offices and whatnot, trying to collect that information, those folks, or gather them from there. So, getting enough interest, explaining what we're doing, was a challenge. And I think, I think one of the unique things about this study was that we did have a lot of outreach, mail out, postcard information, brochures that were actually sent out rather than just pick up at a certain place or location. A lot of outreach went into this study to try to get enough folks, gather their interest, to be able to screen enough folks to it for the study. A lot of community outreach. There's a lot of advertisement that went out with it. So, I think it's very unique from that sense in terms of, again, the group that we're looking for this particular study, and because of the intervention that was, placed. So there was a lot of mail outs with this in terms of gathering enough folks for it.
I see. And let's talk a little bit about outcomes. So I imagine that you want to slow the progression of disease. What were the specific outcomes for the study? How did you measure that? And what were the main results that you found?
Well, so going back to the study, and a lot that will come, and a lot to be determined still in terms of getting all the information out, published, and whatnot. But we gathered a group. The group was broken down into those two arms. One arm involving stretching, balancing, range of motion, like we said. The other arm getting aerobic exercise. And we pretty much were measuring and looking for outcomes on cognitive memory testing measures, okay, seeing how people would perform. And, I think the biggest takeaway was that we, didn't see much of a difference between the two groups. And then keep in mind, both groups were essentially in a intervention, meaning there wasn't one where we didn't have folks do nothing, right? And so that we do have to have further analysis with this, but both, groups essentially didn't have much of a difference, but at the same time too, both groups didn't show much of a cognitive decline from their baseline. So I think that that's important information that we got from this. Okay. More analysis obviously has to be done with it still. Closure wasn't too long ago. And we're trying to understand what the significance and what all the details went into, showing such findings on there. So I think there is more to come, but I think that that is good, hopeful information on there, that making some kind of intervention where your behaviors are modified and you have some form of physical activity involved, that it is helpful from that sense.
I see. And this was over the period of 6 months, or was it a year that you found no difference? Did it hit that goal in terms of?
So it was over 12 months over there. Yeah, essentially what it boiled down to. Some of this happened during the COVID pandemic, and there was different other things that we had to figure out around that period of time.
I see. And so because you did not find any effect of the intervention, what are the next steps now? Would we want to see maybe a more rigorous intervention, or do we extend the time more than 12 months?
Well, for clarity on that, it was that we didn't see a difference, too big of a difference between the two groups. And both of the groups were actually interventions in terms of some form of exercise. One might have been more intense than the other group. Okay. And so, we think that regular activity and exercise, regardless of the intensity, might be helpful in protecting against cognitive decline. So that's the way to put it, I think, from this. So we are trying to understand this further, but that's kind of our takeaway, more or less.
The message.
Yeah.
I see. Great. Now, shifting to the NEAT study, which is not a lifestyle intervention, it's more of a drug intervention. Could you give us an overview of the goals of that study?
Yes. So that one, it was more of a smaller proof of concept study to see whether or not, I'm sorry, I'm going to shift a little bit here. Nicotinamide, a vitamin nicotinamide, would have an impact on some of the markers that are related to Alzheimer's disease. Okay, specifically, we were looking, so outcome-wise, we were trying to see whether or not there was an impact on levels of a change in one of the proteins that's involved in Alzheimer's disease, tau. And so we, again, same kind of deal where we had two arms, right? And we're trying to see if there's a difference between the two here in folks that got the nicotinamide and folks that did not get the nicotinamide.
I see. And for listeners who might not be familiar with tau, can you explain what the importance of tau is in the progression of Alzheimer's?
Yes. So, when we think about Alzheimer's disease, we typically hear about the plaques on there, but it's usually the plaques and the tangles. And so we hear about the buildup of the plaques, but there's also a buildup of the tangles, which is another deposit or protein buildup in the brain that happens in Alzheimer's disease. And that tangle is essentially made up of a protein called tau on there. And so those are the two kind of key findings that we're basically looking for when it comes to Alzheimer's disease, or some of the targets of this. And so, you hear much about the amyloid and the plaque, but I think this is unique in terms of that, hey, we're looking at the other protein here with this study here. Again, it's a smaller study, proof of concept to see if there is an impact on this protein called tau. And we're specifically looking at, a change in the way that protein is chemically shaped, which is called phosphorylation of it. Okay, but in terms of how it's chemically appearing, and that's what we're measuring for this study here.
I see. And is the goal to remove or reduce the level of tau in the brain, or is it similar to how these anti-amyloid therapies work with plaques?
Yeah, so the way the study worked was that we, like any studies, we typically give an intervention and then we measure something if there's an impact or not, right? In this particular study, we're measuring spinal fluid levels of this tau. And, we were looking for a change in, a significant change in the level of the tau that has the phosphorylation, the chemical appearance of it, compared to the group that got a placebo, right? So we're essentially, measuring that. And are you going to ask me about the results in a little bit here?
Yeah, I will. I will.
So that's probably the next question related to it.
Yeah.
So essentially for this particular study, again, it was a smaller proof of concept study. A bigger objective of it too was actually just to check out and measure safety levels, whether or not it could be tolerated, okay, which we do find that it is in that sense, okay. But from this tau question, we don't see a significant change in the level of the chemically modified tau we were speaking of a moment ago, but we do see a trend and a decline there. So this is the situation where it says that, hey, it indicates that there might be some decline, and that it's probably, there is some value in terms of investigating this further with a larger study. This is what it would point to, if that were the case.
Right, and just to be clear, the participants didn't know whether or not they received the nicotinamide versus, say, the placebo or the non.
Yeah, they were randomized for it on there.
Got it. And so what were the results? Can you give us some updates on that?
Yeah, I mean, it's pretty much what I just mentioned on here, that that we were looking again for a significant difference or change in the level of that phosphorylated tau on there, which we didn't see, but there was a decline in those levels, and it goes into some of the statistics and how you analyze this data on here. So we didn't see the statistical significance on it, but we did see a general decline in the phosphorylated tau levels on there.
I see.
Okay.
And
So that's,
go ahead.
Sorry?
What would be the next steps, I guess, if you're starting to see a trend going down in the direction that you expect? Would you then want to do a bigger study?
Yeah, and so that's so taking a step back, that was the primary outcome that we were looking for, that and the efficacy and safety of it, which again, I think we see that is okay on there. And then some of the secondary other outcomes that we're looking for is whether or not there is a clinical impact. And it did, on one study, one of the markers that we're looking at in terms of measuring memory change, dementia, and the impact, we did see a little bit of a decline there too, in terms of memory not worsening very quickly on that. Okay, if that makes sense.
Mm-hmm.
So that's called a CDR scale on there. So on that measurement, there appeared to be a significant less change or worsening of the cognitive, the dementia rating scale on that. So there seems to be some benefit. Again, this is a small study, but to the question you were asking, these findings on here does indicate that we would hope for a larger study to be able to measure this further, essentially.
Great. So that would be the next step then.
Those would be the next steps on it.
Great. And so you mentioned measuring this in the spinal fluid. Were there any challenges in getting participants to undergo this procedure? As you look at the challenges, broad challenges that we experience with recruitment in general.
Yeah, I mean, I think for some of these studies, again, you have the same kind of challenges: outreach, getting enough into the different communities, and being able to look at a diverse enough population. Same kind of challenges for both of them. In this particular study, there is a little bit more of an intervention in terms of we do have to measure the spinal fluid levels with a lumbar puncture, which is a procedure to do it. And so that it's a little bit more of a challenge to reach out to enough folks, find folks that are willing to partake in that procedure and get done. So you get a little bit more screening and whatnot to have to go there.
And did you experience any specific challenges with recruiting diverse participants in either of these studies?
Yeah, I mean, I think it goes to just a lot of studies in general in terms of recruiting, a wide enough and diverse enough population. Again, outreach is the main thing. For both of these studies, I think the Exert one, because it was such a significant mailing and media and reach out to the community meetings and whatnot. That we went into different communities and advertised what we were doing and told them folks about what we were doing with that study on there. So all attempts, I think, were made to try to reach out to as broad as you can. Sometimes there's the challenges of doing a lot of studies. Sometimes it's the selection, like folks who are interested in doing it, folks that would be willing. Sometimes we see these kind of challenges in a lot of research studies in general.
Yeah, definitely. And in what ways do you think that the results of the Exert and the NEAT study could potentially influence, say, guidelines or recommendations for older adults regarding physical activity or nutritional supplements? Any advice there?
Yeah, I mean, again, I think both of them, there's more data to come, I think, in terms of what the data analysis, the results, there's going to be more to come in terms of that information being released. So I think, we'd have to wait on that in terms of like specific guidelines per se. Again, the need, it speaks to more or less that, hey, there's probably going to be good reason to suggest or want getting a bigger study done, right? So it's hard to, or premature to say, guideline wise. For like the Exert study, it speaks to that exercise, again, as a behavior that we should be all kind of doing. it's not. There does seem to be a benefit from doing it, regardless either way, as long as you're doing something on there. So it would probably mirror at the very least, I think, in other guidelines in other disease states in terms of recommending exercise, like for the heart, for diabetes, or for high blood pressure, right? So I think there's that additive effect of whether or not we can get that from it. We are hopeful that when we get those results.
Very exciting, very exciting. And just one last question. Outside of the rigorous demands of these clinical trials and academia, how do you keep yourself inspired and energized in your research endeavors? And are there specific books that influence your perspective on patient care, or the hobbies that you do? Just a little bit about what your experience is.
Yeah, I think you're speaking to more of a personal question in terms of like, hey, how do I, stay kind of active in terms of in what we do and keep motivated, right? I mean, I think we, the researchers, all of us, I mean, I think we'd echo that. Yeah, there are a lot of demands. We are busy. I think for the most part, most of us enjoy what we do in terms of why we're doing this and whatnot. So I think that's pretty good motivation, I think, for a lot of us. And, when you wake up in the morning, you have some goals centered around that, I think. That being said, I think, everybody has their own way of de-stressing, so that they can recenter on their goals. I personally try to exercise whenever I can. So, that's why the exercise study, I think, is a really, unique and an important one in my mind and in my heart from it. So I do try to exercise daily on there. Before COVID, I was actually like running a marathon pretty regularly, like at least once a year. So exercise always has been an important part of my life. Personally, I find that my mind is clearer, freer to think, easier to, get to what I'm doing when I do get a chance to exercise. And it's something that I always try to encourage patients whenever they can on there. What it looks like is always going to be different for every individual, in terms of, some people like to run more, some people might like to hit the gym more, right? So there's all those differences with that, I think, but, those are some of the things that I try to do to keep me, grounded and motivated and fresh for the next day and continue on with this.
Great. Well, excellent advice and great recommendations. It looks like you had a great experience being a researcher and a clinician as well in these important studies. So I want to thank you very much for joining us. And lastly, how can we learn more about your clinical and research work?
I think the best way is to reach out to UCI Mind, UCI Mind, and as well as they can get more information on what we do, obviously, but they can probably also connect to the clinical side of things in terms of where we see patients and whatnot. And lastly, on your introduction, I just wanted to be clear. I'm actually a internal medicine trained physician who is a geriatrician. Who did a little bit of a subspecialty with geriatric neurology. So that's not to say that I did, two kind of training programs where I'm also a neurologist or not, directly on there. So my background is a little bit different from a lot of folks from that sense. Just
That's great.
So you're aware.
Great. Thank you so much, Dr. Tan. Thank you for joining us on Ask the Doc. And any final comments, Dr. Tan?
I think it just speaks to, there's more to come with these particular studies. There's still a lot of other studies in the pipe work on there. Again, a big thank you to all the folks that participate in our research studies and all the research studies, throughout. None of this information is available without you participating on there. So I just can't thank folks enough for doing it.
Great. Well, thank you so much. And thank you to all of you who attended this podcast live today. You can access this and past Ask the Doc episodes on our website, which is mind.uci.edu /Mindcast. And next month, we'll be chatting with Dr. Liz Trastril about spatial navigation. In the meantime, to learn more about research at UCI Mind, you can visit our website or consider signing up to the UCI Consent to Contact Registry, which is c2c.uci.edu, to learn more about research studies that might be right for you. So take care, and we'll see you next month for Ask the Doc on UCI Mindcast.